Welcome everyone to this panel. This is being hosted by the School of Education at American University, as well as SEIU's Local 500. We're really excited to have you here today. My name is Liana Petruzzi, and I will be hosting today's webinar with Keisha Hayes. Thanks for joining us. Before we begin, I just wanted to make some quick acknowledgments, announcements, get us kind of situated. I'm going to start with a land acknowledgement. American University is located on the traditional territory of the Nagachoktek, Anacostia, and Pikistaway people, whose care and keeping of these lands allow us to be here today. I also just wanted to acknowledge kind of what a devastating year this has been for the fields of healthcare and education, and kind of contextualize why we're having this discussion, why Keisha and I kind of came together and said we thought this would be really important to talk about. So thinking about like federal and state legislative attacks on our basic rights to accessing public and freely available education and healthcare. So that's kind of where we're at. And we've seen, the defunding of hundreds of NIH and NSF grants that were loosely related to diversity, equity, and inclusion. But we know that those terms have been used very loosely. And this has, cut millions of dollars of appropriated funds. This has directly impacted communities and clinical trials. This is pretty unprecedented, I would say. We've also seen the expiration of marketplace subsidies. So people are very actively having their healthcare costs skyrocket, as well as cuts to Medicaid and food access, like SNAP benefits, which are really lifelines for millions of Americans. But in spite of all of that, we've also seen, a huge resurgence in organizing and policies and leaders and unionization that is really focused on how do we keep our rights and how do we organize. And so that's sort of where we're focusing today. How do we keep the government doing what it's supposed to do, which is providing public goods and services, and how do we make sure that people are accessing education and healthcare? So with that kind of backdrop, I'm going to briefly introduce myself. I'll pass it over to Keisha Hayes, and then I'll introduce the panel and just, describe how the panel is going to go today. So as I said before, my name is Liana Petruzzi. I'm an assistant professor at American University in both the School of Education and the Department of Health Studies within the College of Arts and Sciences. I'm a healthcare social worker by training. I previously worked for Ascension Seton in Austin, Texas. So that's where kind of my clinical and healthcare expertise comes from. But my current research really focuses on social care interventions in healthcare, public health, and community settings, with a particular focus on perinatal health and mental health. So Keisha, I'll pass it off to you to introduce yourself.
Thank you so much, Leanna, and thank you everyone for being with us today. We're really excited about having you here. My name is Keisha Hayes, and I'm a faculty member in the School of Education at American University. My background is in university-assisted community school initiatives. I led one at Teachers College, Columbia University, and that's really where I fell into or leaned into this idea of health and education being inextricably linked when we talk about community development, when we talk about the wellness of communities. This is the second in a two-panel series. We had an earlier panel that focused on the power in education and health, looking at interventions and looking at how different organizations are doing the work with schools, in communities, with health organizations. So this is really exciting to have this as a follow-up. And I turn it back over to Leanna.
Okay, great. Thanks, Keisha. So before I introduce the panelists, I'm just going to briefly review the format of today's webinar. So the first 30 minutes or so are going to be a moderated panel conversation. And then we're going to have some time for Q&A. There is a Q&A icon down at the bottom of your Zoom. So this is where you can enter any questions or comments. So you can enter those throughout the conversation, and then that's just a great way for us to track, your questions, and we'll try to answer everything as we go. Okay, so now in terms of introductions, so I'm going to introduce the panelists. So starting with David Cabe, an assistant director of the Office of Institutional Research and Assessment at American University in Washington, D.C. He's also an elected union representative for the American University Staff Union, SEIU Local 500, our co-sponsor, and a political educator. So thanks for being here, David. We also have Jessica Tang, who is the president of AFT Massachusetts, which represents over 25,000 educators, librarians, health, and public service workers. She was previously the president of the Boston Teachers Union from 2017 to 2024. Jessica also serves as a vice president of the Massachusetts AFL-CIO, is the former executive vice president of the Greater Boston Labor Council, and is the founding chair of the AFT Asian American Pacific Islander, or AAPI task force. As a teacher activist, she has been involved in many different community organizations that are working to advance racial, social, and economic justice. She got her bachelor's degree at Harvard University and holds an EDM from the Harvard Graduate School of Education. Thanks for joining us, Jessica. Then we also have Joshua Neff, who is a psychiatrist who organizes physicians with CIR, SEIU. So we'll hear about a particular part of SEIU's union, and SEIU Doctors United. Clinically, he works part-time in a California prison and has a small therapy-focused solo practice. Thanks for being here, Josh. Then we have Kaylin Price. So she is a neuroscience PhD candidate at George Washington University and a graduate student union representative with SEIU. Thanks for being here. And finally, we have Michelle Munikiwa, a political and medical anthropologist by training, who graduated from the joint MD PhD program in anthropology at the University of Pennsylvania in 2021 and recently completed residency in combined internal medicine and pediatrics at Penn in the Children's Hospital of Philadelphia, where she has stayed on as a fellow in adult and pediatric infectious diseases. And she is currently an SEIU CIR union representative. So thanks again, everyone, for being here. So I thought maybe we could just kind of start by sharing a little bit about what is your role in your current union? What does that look like? And what are the current initiatives that your union is undertaking related to healthcare education or anything, under that umbrella? David and Kaylin, I thought maybe we'd start with y'all in higher education, and then we can transition to Michelle and Joshua and think more about like hospital and healthcare institutions. And then finally, Jessica, I'll have you kind of wrap up that question to think about the intersection. So David, I'll start with you.
Sure, thank you. So our union just recently ratified our third contract in a relatively short time frame because we started in 2022, some in our first contract, so we've been three over that period. In terms of what my role is, I've been an elected union rep throughout that whole period since the first contract. And so what that means is that I'm supporting our members in terms of any contract violations and things like that, but also organizing. So it's sort of the service of when people have problems, but also organizing around, winning a new contract and other things like that. So I have a subset of the membership that I'm responsible for in different pockets around the university. In terms of some of the things we're focusing on, like higher ed everywhere, we're experiencing challenges. There's the long-term challenges of the neoliberalism of education and the more specific challenges that we've experienced over the past year. And then, so it's both those sort of external forces, but also how those things are being addressed internally. American University is tuition dependent, so we rely a lot around enrollment. So enrollment challenges can create issues there. But then the big questions revolve around what are we doing about it? Like how do we address budget challenges there? How do we ensure those aren't happening again? Or like deal with them in the future? So, the big sort of question around all this is the question of power and decision making. Like who is involved in those decisions, whose voices are being heard, and what decisions can be made um, by management on its own versus like other members of the community. And in all those things, our union is working. So we're one of three units on campus through SEIU Local 500. So there's also the graduate students and the adjuncts. So we each have our own contracts and things like that. But we're also working with faculty and students because a lot of the challenges we're facing cut across all those groups. So I'll stop there.
Awesome. Thank you. Kaylin, what does it look like at GW?
Yeah, thank you for that. Um, I am a graduate student worker, and we recently unionized. We're currently bargaining for our first contract, so I think we're in a really unique position, where we are really figuring out what kinds of things to focus on in the contract and getting an idea from the entire unit of where those priorities lie, especially in terms of healthcare, education, all those economic pieces. But also thinking about things like how we address issues of inclusion, diversity, all of those like tricky words in the higher education space right now. I think being on the panel with a lot of folks who have a lot more experience in the space, it's really interesting to see how that transition happens from going to first contract and then getting into a place where you are organizing not around a first contract, but around other issues that arise. But we're really at a place of organizing around that contract, and so that's where a lot of my energy has gone right now. I am technically a grievance officer, but we don't have a contract, so we can't issue a formal grievance process yet. So a lot of what my role has looked like has been organizing, getting folks to come out to our open bargaining sessions, which on its own was something that we had to fight for. Getting folks to understand what we are putting into the contract and why, and how that bargaining process goes between us and management. So a lot of it is just doing that groundwork of the education piece and getting people on the same page, and understanding what that looks like, because especially for grad student workers, most of us have never been in a union before, don't come from union families, so it's really getting everyone on the same page to understand what kind of power we even have and why we should do this work at all. So that's where we are.
Thanks so much for sharing that. Michelle, what has it looked like for you on like the SEIU CIR side?
Yeah. So I guess in terms of the role that I have, it's sort of two parts. One is as sort of a local leader, as one of the delegates at my training institution at the University of Pennsylvania, but also as one of the regional vice presidents of the sort of on the national executive board, representing the Mid-Atlantic region and especially Philadelphia. And I think those two roles have slightly different focuses. So I think at Penn proper, we, very recently ratified our first contract, and now we're in that period of contract enforcement, which has many layers to it, including figuring out how we're going to hold the administration of our institution accountable to the contracts that they agreed to, within a context in which, like, there are certain kinds of, say, national legal actions that it might not be advisable for us to take during such a hostile administrative environment. And then I think additionally, as an institutional union, we're trying to figure out what it means, for us and what the flavor of our union is going to be. I think what's interesting about being sort of a house staff union of residents and fellows is that we sort of have the institutional vulnerability of being trainees and perceived as students, who are sort of lower in the institutional hierarchy. But I think socially, as physicians, we have an incredible amount of social and cultural capital that we can use to advocate for our patients and communities. And so navigating that shared institutional vulnerability with social power is really important. And then I think on the city level, because CIR, CIU has grown so much over the last 5 years, we have actually had multiple shops unionized within the city, such that the majority of medical trainees in residency or fellowship in Philadelphia are now members and working on contracts, which means we also have this like citywide capacity to really like push for advocacy and for change and to push back against some of the things that are happening and to be active political participants in our communities, which is something that I think is also being replicated nationwide. So I think it's a really exciting time to sort of leverage the fact that we're sort of in the middle of this kind of like both healthcare and higher ed space.
Yeah, thanks so much for sharing that. Josh, anything to add?
Um, I think Michelle mostly covered it. I'd maybe say one thing that occurred to me when you were speaking, Kaylin, is just the commonality that we have between grad student organizing and medical resident and fellow organizing, and in the sense that, like Michelle just said, in terms of where place on a hierarchy, but also how often on the one hand, how rapid the turnover is, right? So our average duration of membership for members of CIR is, which stands for the Committee of Interns and Residents, is 3 years. In other words, a third of our membership of our whole union turns over every year. So that presents significant challenges on the one hand, and yet on the other hand, I know both my sense is that grad student unions have been growing really rapidly. And my understanding is that CIR was the fastest growing union local in the country for a number of years. We had about something like 10,000 members and maybe, I don't know, it was like 2013 or 2012, something like that. And now we have over 40,000 members out of 150,000 residents and fellows nationwide. So we've grown incredibly quickly. And I say that just to say, I think it's really exciting because there is so much. I think partly because of where people are in the hierarchy, they see clearly the need for collective action and being in a union to have adequate workplace protection, et cetera.
Yeah, and I could see like the fact that there is so much turnover, that means that people are going on to other positions. So like kind of bringing those skills and bringing that framework and mindset to all these, more leadership positions or maybe positions that wouldn't be eligible for unionization otherwise could be really beneficial, like from a more structural level.
Yeah, and we hope to also unionize more post-residency physicians over time as well, along the lines of what you're saying. These are people who our members go on to be other, post-residency doctors.
Great. And Jessica, I don't know if you can share a little bit about AFT, especially considering that you have like both kind of healthcare and education folks that you're representing.
Yeah, maybe I can speak a little bit more to the K through 12 piece because that hasn't been mentioned as much. But we think about health and education, I think, in several different categories. So first is just literally in your workplace, but not just the educators and the union members, but also our students too, because we, say oftentimes our students' learning conditions are our teachers' working conditions, right? And so we think about both mental and physical wellness. So for on the physical wellness piece, it might literally just be around advocating for fixes for exposure to allergens or mold or mildew and things of that nature. So we've done a lot of advocacy work around the Mass School Building Authority and getting funding to actually upgrade our schools, and while we're at it, green our schools. Because if students and educators aren't in physically clean, safe environments, that impacts their health, obviously. So there's that piece, but then also the mental health piece is another huge consideration that we have, and that goes also for both the adults and the students in the schools. So if we do have dysregulated adults, that doesn't support our dysregulated students, and then we need to have the supports for both our students and adults. And for the students, that might be bargaining for, we do a lot of bargaining for the common good. So we have, fought for a full-time nurse in every school building. We didn't have that actually until right prior to the contract, before the pandemic, which was so important during the pandemic that we had a full-time nurse in every school. But we've also advocated for more guidance counselors, social workers, school psychologists as well. But then we also advocate for the needs of, again, the educators who also were dealing with a lot of dysregulation and mental health issues. And so part of our work also is not just negotiating healthcare, but also negotiating benefits and then ensuring that our members know what those benefits are and how to take advantage of them. Because preventative care actually is super important to helping to bring down costs as well. But ultimately, the costs continue to rise, and this is a huge issue because even if we are able to negotiate raises right now, oftentimes it's completely negated by double-digit rises in healthcare costs for our members. And so trying to wrestle with what we're doing there in terms of bringing down the healthcare costs is a bigger issue than just our union. And so at the Mass AFL-CIO, we've actually advocated for, and a new committee was just created for our unions to come together and figure out how we tackle this healthcare crisis issue and affordability of healthcare. And so those are some of the things that we're working on, moving from K through 12, then all the issues that impact us K through 12 through higher ed and in other sectors as well, because everyone's going to be impacted by, the loss, what's happening with the federal government, the loss of Medicare and Medicaid, SNAP benefits, all of those things impact all of us.
Yeah, absolutely. And I feel like benefits and pay are like the first thing to go, right? Like we've seen this in terms of the way in which budget cuts are managed. And so I think that that's, whether that's impacting like students and communities or literally the people who are working in these institutions, like this is what's kind of on the chopping block oftentimes. So my next question is, how can we create more effective narratives that highlight how unions meet both the labor needs of educators and the learning health needs of students, kind of like what you were just talking about, Jessica. And I don't know if you want to start, Jessica, and then we can kind of, I'll, call on people to comment.
Sure. I mean, I think that we need to highlight, I think opportunities like this, but certainly there's many other ways that through our communications and our public outreach and our community coalitions, we intentionally engage through our negotiations in many of our locals across Massachusetts, what's called open bargaining, and intentionally use bargaining for the common good to engage coalitions also in helping to figure out what are we fighting for. So when we were fighting for a full-time nurse in every school, our parents and community members knew that. And so when we're negotiating our contracts, they see, we're not just actually fighting for higher pay raises for our own members. It's really about these common good issues that impact many more people than just our members. And so in addition to negotiating again for those social emotional learning kind of positions like guidance counselors, social workers, nurses, et cetera, we also engage our community in helping to fight for programs or initiatives or strategies called like community schools. And for those who aren't familiar with community schools, it's a strategy that really engages parents, family, and the community to address the whole child and the whole family needs, and understanding this kind of concept of Maslow before Bloom, that if people's basic physical needs aren't being met, then it's a lot harder for them to come to school ready to learn. And so through community schools, we're able to get the dental clinics to the schools. We're able to get the vision assessments so that students who need glasses can get glasses in the wraparound supports. And when we're advocating and negotiating for things like that in coalition with others, so for example, we have a bill right now at the State House where we're advocating for a commission to look at how we can expand community schools, and also had a bill to actually increase funding for community schools. Then I think the larger community can see that, one, we're real partners in advocating for improvement of the health and wellness of our students in our school communities and improving our schools. But two, you're building relationships. And then three, you have this larger narrative where people can see that actually unions are critical to improving the education and health of everyone. And so being intentional about those types of um, strategies, bargaining for the common good, community schools, and advocate and making sure people know. A lot of people don't know that, right? That we actually have a nurse in every school because our union fought for it. Right. And so if we're not the messengers to sharing out what we're fighting for and why and what we've won and how they're benefiting our students and our larger community, then no one else is going to do it. So we've got to do it intentionally ourselves.
Yeah. Yeah. I mean, I love that. Like the messaging of wins is so important, right? Like if it just stays in like a little silo, no one knows what's happening. And since someone put this in the Q&A and it's relevant, can you just explain what bargaining for the common good means for people who might not be as familiar with that term?
Sure. So it's essentially a strategy, and a lot of unions already do it without even maybe calling it that. But there's actually a great website from ACRE, and you can Google bargaining for the common good, and there's like a whole uh, longer, deeper definition. But it's essentially making sure that in your negotiations that you're not just bargaining for kind of what's known as bread and butter issues of like wages and benefits, which are important and we need to do that. But also thinking bigger picture about how do we use our collective power and engage in bargaining with community partners so that we can win issues that are commonly not considered typical subjects of bargaining, but are things that, again, like more guidance counselors, lower class size ratio. But we've also done bargaining for the common good in terms of like climate fights, right? So we now have at the Boston Teachers Union a climate curriculum committee, and that might not be seen as a typical bread and butter issue, but our members felt that ensuring that there's climate curriculum throughout our K through 12 experience was important. So that was something we bargained for. We also bargained, for example, funding and vouchers for students who were experiencing housing instability and homelessness. And we believe that if we partnered with the city and other community organizations, that we would be able to find housing for our students who are facing housing instability. So that's another example of bargaining for the common good. But again, it's using our collective power and unions and working with our community partners to be able to win things in our contracts that may not be seen as typical union bargaining issues. I hope that makes sense.
Yeah, I think that's really helpful. And I think like where I've seen this more in healthcare spaces is, for example, in a hospital that only has 5 social workers, they're not going to unionize. But when their nurses unionize, there can be a way of saying like, hey, what's impacting you? Like what's impacting your coworkers and your colleagues who might not have that same leverage, but are impacted by similar things like ratios and hours and pay. And so there's like this way of saying like we're not just focused on ourselves, but we're seeing like the broader picture. Michelle, and then I'll ask Kaylin this as well. Like, what has open bargaining looked like, in your context and thinking about this, like bargaining for the common good?
Yeah, I mean, I think it's been really helpful because I think, I mean, um, part of, I think, what has been driving the growth of CIR, SEIU in the last 5 years is a sort of way that physicians in general have been politicized as workers and really thinking about themselves as employees and the vulnerabilities that they experience in line with their patients in our communities. And I think COVID and concerns around PPE and testing and vaccination and all of those things, I think really made that very clear, and made people feel really activated. But I still think that, early on in our unionization, at Penn, I think we still did face the issue of making sure that people really understood like what their relationship with the boss really is, right? Because we have this complicated thing, right, where like in very similar to I think graduate student workers, there's a sense that you have this mentorship and sort of like intimate personal relationship with the direct people who are training you, that sometimes obscures the relationship you have with the institution that pays you and determines your benefits and defines the conditions of your labor. And so having open bargaining was really helpful because, we would have like hundreds of people from the hospital on these Zoom sessions, like hearing how the, boss's lawyer would discuss our pay and our benefits and what we were entitled to, and really being able to get people like activated and energized about what was on the table, and really helping people understand that basically everything yes, our pay, yes, our benefits, but also like what our hospital's relationship is to the community, like what we owe our patients in terms of funds, like what the conditions of other workers are in our hospital. I think all of that was on the table. And while we didn't necessarily get wins about all of those things, I think some of those conversations were sort of the driving force of our contracts, which came with both incredible pay raises, changes in our capacity to take paid time off, but also a sense of like what's within our scope of practice. And that sounds like it's mostly because, we don't want to do that work, but also to say to the hospital, like, you should be hiring staff to do X job that you are now passing off to this community, to your point, Leanna, about like how we're all in this ecosystem of labor. So I think open bargaining has been such a big benefit to us. And it's been really interesting to watch the other shops in Philly have open bargaining and then also conversations about what our various institutions who all hire the same lawyers, right, are doing to us and saying about us and our labor. Yeah, it was pretty helpful.
Thanks for sharing that. Kaylin, what does it look like at GW?
Yeah, I mean, I would echo all of what Michelle just said. I think we, as graduate students, and I'm coming from STEM in particular, I think is notoriously, or at least has a reputation of being difficult to organize. And not because people don't care, but because I think people see themselves as having a specific kind of relationship with their advisor that is separate from the rest of the university. And they are really concerned about how that relationship with their advisor is tainted by being a part of a union, for example. And so I think having open bargaining allows people to actually see themselves as part of a whole. And to hear exactly how, first of all, like they are not separated from or special as compared to other kinds of graduate student workers, and don't have maybe some of the protections that they thought that they had. And I think also in understanding, as Michelle just said, hearing how the lawyers will talk about their work even though they have never done it and don't know anything about it, and somehow have these grand judgments about who is actually working hard and deserving of certain basic protections and wages and benefits, in addition to all of the other things that influence our working conditions, like having a safe classroom to work in where there's not mold and the ceiling isn't falling down or smashing your fingers. And so things like that, I think, is also helpful in open bargaining where, having a really like powerful bargaining committee who is bringing in their own personal stories. And that takes a lot of vulnerability to share, like, this is a thing that happened, which I think also is important in those dynamics where you know that you are up against a concerted effort not to give you the things that you're asking for, having a specific story of like, this is why this matters. And it's not a big picture that's divorced from like people's individual experiences. It's like, this is a specific story that happened to me or a student that I know, and this is how this influences us. Not having these protections actually matters in this very tangible way. And I think being able to hear that from other grad student workers, because I think also in higher ed, we are so siloed. And so a lot of people don't really know what's happening in other departments and don't know what issues are and are not shared across different parts of the university. And so I think that is also really important in thinking about what we can and should be asking for that influences not just us, but the working conditions for other staff on campus and the conditions that students are learning in. So yeah.
Yeah, thanks for sharing that. I think there's also just a benefit to knowing like what could we have as benefits and like what could this look like? And oftentimes if you haven't asked questions, you might not know what's going on. But I can just briefly share that as a graduate student, I had a child. It was also during COVID. And I found out that I wasn't eligible for FMLA because the university didn't include classwork as work. So even though I was doing 20 hours a week of classes, they were like, well, that's not work. So, like, the way that lawyers and institutions quantify work makes you eligible or ineligible for certain things. So, it's like, oh, you're going to have a baby, but you're not going to have health insurance. So, like, on a graduate student stipend. And you're like, how is that possible? But understanding these nuances is really important. And then when you have unions and you have spaces where people are sharing their experiences, then you're all of a sudden able to say, well, it should be different. And what can we ask for and what can we like, bargain for? David, I'm going to transition to you to kind of talk about what either open bargaining or bargaining has looked like at AU, or kind of thinking about how are we connecting these education and health issues.
Sure. So we've also done open bargaining that's involved, our unit is around 560 people. I think our membership is 400 something. So a typical day in bargaining, which took a long time, was 100, 150 people showing up in Zoom. Um, all the things that people mentioned, it is transformative to hear what is said about you on the other side of the table. It's transformative to have people who don't know anything about your work, who couldn't find your office, who's never been involved in this area, or just like disconnected, who have really strong feelings about what you should be doing, what you need, and that aren't listening. And so it's really helpful for people to see that. It's also transformative, as was just mentioned, to hear other workers' stories. A lot of what happens to people in general is they experience a thing and think, I'm experiencing this because of me or because of the person right directly in front of me, when so much of this is happening because of larger structural forces. So yes, people are making decisions, but it's bigger than you. And hearing other people's stories, connecting, it allows you to connect your experiences to their experiences and those other things in a way that is really powerful. And you can know those things to be true. It's not the same as hearing other people's stories together. Like that moves people to action. It changes you. Um, for the most part, our open bargaining has only been internal, but on occasion we have had other members of the community turn out. I can remember one of my very first experiences in our first round of bargaining where there was a faculty member who came with us and on the Zoom, and it was radicalizing for them, sort of saying like, why are you being treated this way? Why is this happening? Someone who was obviously supportive, but moved into a different gear, sort of seeing it for real. And then the other thing then is, as a result of so many people being here, you can get that message out. You can be talking with many more people. It becomes a topic of conversation in the community in a way that's really powerful, and that helps those other people see that what we're fighting for is connected to them. And that's something that I would say we've experienced throughout. The students and faculty and our alumni have understood that our fight was their fight too. So it's not to say there's no tensions there, but it is one of the big questions: how can you win any of this stuff without the power of organizing, without the power of labor? And that's true. I think it's a good question to ask with your employer, but it's also a good question to ask globally, socially. Like, how on earth are we going to win the sort of big changes we need to make sure people's healthcare needs can get met, their educational needs can get met, if it's not through organizing? It's not to say that elections and those things don't matter, but it's very clear those things on their own will not deliver that. Ordinary people have to find ways of bringing their own power that rely on the sorts of power that is much more broadly distributed. Things like their time, their energy, their creativity. That's all the stuff you learn doing this work. And as we mentioned already, it's things that translate into other spaces. So people learn this in a workplace environment and can take it to organizing their community. If there's a hospital closure, they can take it to their building. In tenant organizing, they can take it to their next employer. Our students are learning about organizing, and then they're going off into the world. So there is this possibility of the impact being much broader than whatever you're doing on your own. It's that the skills you're building, the relationships you're building, the power you're building is important, not just the change you're winning.
Yeah, I love thinking about that domino effect. It definitely helps. Josh, anything to add before I move on to the next question?
Just say, when thinking about how do we need to change the narrative around how unions are perceived? I agree with everything everyone else has said, and just would add that, yeah, I think on the one hand, we're up against, decades of anti-union propaganda that is sort of diffused out into the collective consciousness or whatever. And of course, that's quite unfair and unreasonable in the sense that it'll be like, sometimes unions do things in not the right way, which is like, well, yeah, it's a human institution, and so that is true. But like, if I compare having now been on the staff side and being on the executive committee and member side of CIR, I can say, yeah, it's not perfect. And oh my God, compared to the hospitals I've worked at, it is so much, um, you know, better run, less corrupt, less shady. And so that's the one hand. On the other hand, I think the way fundamentally we need to change the narrative is, and we need to do this anyways to be effective, is just be really well run, really well organized, really well structured and disciplined to be effective so that members have a direct felt experience of like, oh wow, this organization really has its shit together. I know where I fit into it and who my like, rep in my department is or my cohort is or whatever. And then so it's just a lived experience of like, yes, this is effective. In addition to everything David was talking about the just the way it's transformative to be part of a bargaining unit that's fighting and winning things.
Yeah, yeah, I think the anti-union messaging is so important. And I think that in particular, it has been about teachers' unions, right? Like, I haven't heard it as much with like police unions, although we could certainly talk about that. But I feel like the narrative with teachers' unions that I often heard was like, oh, it keeps bad teachers in their job, right? Whereas like I had to teach, like both of my parents were teachers in unions, and I was like, the way that I see it is it's like protecting their rights. Like someone needs a surgery, and so they're actually allowed to like take time off. Or so I think that like having those lived experiences are some of the most powerful things to combat these narratives that if you don't know someone who's in a union, you might be like, oh, wow, they keep bad people in their jobs. That's not great, But then when you actually start to like look under the hood, you're like, wait, is that what's happening? So I appreciate that perspective.
I could just echo as well, like, as someone outside of education, my impression is that the back to bargaining for the common good, the bargaining for the common good that the LA Teachers Union and Chicago Teachers Union did has done a lot of work in terms of the public perception of what teachers unions can be. So I think that it's worth just underscoring that point again.
Yeah, and like even in the literature, for those of us who are like nerdy and like, what do we know about unionizing? And, actually, when you have a really strong message, communities often support unions more after there's been like a publicized collective bargaining and when they find out what are they actually bargaining for. So during COVID, this was huge, right? Like, oh, this isn't about their pay just because they care about themselves. This is about keeping schools and students and teachers safe. And this is about protecting the community, right? So the narratives that we tell and share are so important when we're trying to like connect these larger issues. So I guess like building off of that, what opportunities or challenges exist for cross-sector coalition work kind of at the intersection of health and education? And so Jessica, I don't know if you want to start and then we can sort of branch off from there.
Sure. I mean, there's so many, I think, opportunities right now because we're facing so many of the same fights in a lot of ways. So, for example, in K through 12 and higher ed and healthcare, right, where we've gotten what is it called? I call it blackmail, but I don't think that that's what they would call it when they're saying, like you have to get rid of your DEI programs or certain books or certain curriculum if you don't want to lose your funding, right? We're facing challenges around academic freedom, um, and funding. I mean, this is a huge issue right now at K-12 through higher ed and in our hospitals is that we are really worried about the funding loss and then the resulting layoffs and cuts that are going to be happening. And I think we really have to help, whether it be our students that we serve or the patients that we serve, help them to understand what harms are coming, but then how we can work together to fight them. And so I can give some more very concrete examples. We've come together across sectors to fight for the millionaire's tax in Massachusetts. And that has been critical to helping to stop some of the immediate harm that's been happening. But there's also opportunities, right? So while before the cuts were happening, we were able to get free college at our institutions, which raised enrollment in our in our public community colleges. We had free lunch. And we're talking about health for our students. A lot of our students do struggle with just being able to have meals, right? And so the millionaire's tax in Massachusetts really enabled a lot of funding, and that was done through the Raise Up Mass Coalition, which is a coalition of different unions, SEIU, AFT, MTA, which is the NEA affiliate, and a number of community organizations as well. And so that's where I think the opportunity is, because that we have so many of the same fights that we're fighting right now, that we can work in a broader coalition, which is also a part of the bargaining for the common good strategy, right? Is intentionally to do that on purpose. And so we are trying to figure out what we can work on next, and that includes a corporate fair share tax. And we want that funding specifically to go towards healthcare, because we know healthcare is in the health sector is in crisis right now. So those are some specific examples. And another one I'll just share real quick is payments in lieu of taxes. I'm not sure if we're going to get to that question, but having universities and nonprofits like Harvard, having a lot of money, they're having their own crises right now, but that is something that we worked on together too, is trying to get some of these institutions that are considered nonprofits to pay their share of taxes as well in the local community, and or have community benefits.
Yeah, yeah. I mean, I think the nonprofit hospitals piece has also been talked about, at least within Texas. We talked a lot about like the role that Ascension Seton plays, as it's a nonprofit, but like we have patients who are struggling to get their bills, approved for financial assistance, and we have CEOs making like ridiculous profits, right? So what does it mean for there to be a nonprofit hospital, and who's actually benefiting from those tax benefits?
Right.
Yeah. Michelle, I'll transition over to you. Like, where do you see opportunities for these kind of cross-sector organizing?
Yeah, I think that's a great question. I mean, I think I'm gonna echo, I think Jessica's commentary about just sort of advocacy for things that improve healthy communities. I was thinking actually a lot about one of my colleagues was working on a local project where our one of our hospitals is attempting to increase parking for employees, right? Which is part of our imperative, right? Is like transportation. We're obviously having like a lot of transportation issues in the Philadelphia region right now because of some conflicts between our city and state in terms of funding our public transit. But in order to try to put more parking for employees, they've decided to build a garage sort of in the center of an already economically devastated community with increased rates of asthma that really affects a lot of the patients that we see in our hospitals, right? And worsens the health of the community in order to provide some benefit to employees. And so we've been doing a lot of collaboration with people who are advocates for the health of children, for for that space that could have been done. Anything could have been done with that space, and in fact was purchased by the university to use as a space for with an agreement that they would use it for community care and those kinds of things. And then instead, there's going to be like 1,000 car parking garage that's going to make a road much more that already has a lot of accidents more unsafe, increase local pollution. And so that's just an example of one of the opportunities we have to say, like, hey, like we have this relationship. I mean, I think hospitals, allegedly nonprofit hospitals, as we've already heard, are some of the biggest culprits of essentially like parasitic relationships with communities that they do not give back to. And then we're going to do something that might perhaps improve quality of life for employees at the expense of the communities that they serve but do not always live in. And I think those kinds of opportunities to say like, hey, like we have an obligation to try to, for example, solve the problems of benefits for our workers in ways that are uplifting to community health rather than detrimental to them, and to collaborate with people who sometimes know more about what those experiences look like in their communities than we do, even though we see like the end stage effects of that in our hospitals and clinics. And so I think there's a lot of opportunities to notice the things that are happening and that our own institutions are doing in our communities to push back on those in ways that are often aligned with the interests of teachers, social workers, lawyers, other community advocates.
Yeah, that's a really powerful example. And I think it just speaks to the importance of knowing what's happening in your community and figuring out how can you kind of stand alongside community and support them in what they're trying to get done, as opposed to kind of telling them what you think should happen. Kaylin, any ideas on your end?
Yeah, I think one of the big things that has come up is how we build coalition with other folks on campus. I mean, I think um, at least GW is a major employer. There's a lot of people who are across income levels and backgrounds that are dispersed across the city, even outside of DC, because people have been displaced, not just by the university, but by a lot of other factors that are gentrifying communities. So I think one of the things that is of particular importance is how we also reach people who are staff who are working not as graduate students, but in many cases know a lot about the university and have had the experiences before, um, are unionized or have been in other shops across the city and know a lot about the relationship to the city that we could learn from, and maybe even, avoid some of the things that they have seen before in the same kinds of conversations with management that we're having now, but also on how we like gain collective benefits for everyone who I think the university not being separate from the community, but as only being able to survive because of the people who are coming from the community and are either employed there or are in some way interfacing with the university at various times. I think one of the things that is really important too is like the way that the university does and does not value things like discrimination. It does have an influence on other entities. And so I think taking a principled stand on what we want in a contract, for example, I think is a broader, it has a lot of broader implications for everyone else who is interfacing with the university. Like the ability to have services for students who are transgender and just to be acknowledged as existing is not just an issue of what we do and do not have in our contract, but also about like what kind of position the university has as this major employer, as this entity that people see as, whether it's right or not, a moral and intellectual authority. And so I think that's also, having major implications and a reason why we really have to work in coalition with staff and faculty and with other shops in the city.
Yeah, I mean, I think that that's a great example. We've seen, healthcare providers in states that don't necessarily have anti-trans legislation making decisions about who can and cannot access that type of healthcare, right? And people are like, wait a second, I thought that this was a safe place to be for this. And so the ways that these like organizations are making decisions, there's that like complying in advance and that risk management that happens where, lawyers or other folks who aren't doctors are making decisions about medical care services. And, that has a huge impact on employees and the community. And, there's that ripple effect. So I think that's a really good example. David, any thoughts about how you've seen like cross-sector collaboration happen?
I'm going to zoom out a little bit first, which is to say that, and we talked about this a little already, higher ed and healthcare are like structurally similar in a bunch of ways, in the sense that you have this relationship with students and patients that are somewhat parallel, that you have this ostensible higher purpose, that you have relationships with the community in a way that you might not see in, many or maybe that more likely wouldn't be as obvious for, say, for-profit employers, because I think those things all may exist there, but just in different ways. And so that from an organizing perspective, that means that we have those relationships to draw on, and that is actually a tremendous source of power. And it also then shapes the way we do that, because to do our work effectively, we really do need to bring those people on board, and we need to take their concerns seriously. So I think that's a tremendous opportunity, and the parallels mean we can learn from each other because many of those seems to be similar, even though there's lots of differences within those areas in between. There's also a challenge because the fact that we in these fields, you likely came into it because you care about people, because you care about their work. That is something that can be weaponized against us. So the accusation against, say, teachers' unions when they go on strike or nurses when they go on strike is like, oh, you're harming students, you're harming your patients. Um, Usually, that's overblown, but even when to the extent there's truth to it, it's only looking in that particular moment. And it's not looking at what was the long-term trends that led this to happen and what are the changes that can come as a result of that that will protect those people um, in various ways, both by winning things if we're bargaining for the common good that'll directly protect them, but also that no one really benefits from working conditions getting increasingly bad. No one really benefits from people making decisions that don't understand the work. So all those things are interconnected. So it is both an opportunity and a challenge. And then one thing I would say too is that in terms of an opportunity is, and this is not limited to these two areas, but it certainly is there, is many people in the union movement are, I think, figuring things out on their own, are trying to like reinvent the wheel, figure out how to do these sort of things. And so there are opportunities to work together. These things exist in some ways, whether it's locals bringing people across units together, whether it's people meeting informally through institutions like labor notes and things like that, that bring workers together to learn from each other. But there's way more of that can be done. And so there's lots of opportunities to support each other. I think there's many people in the labor movement and beyond are looking for ways to find have an impact. And so the more we're creating opportunities for people to do that, the better. I know I can think of the experience of having been on strike and then being done, and obviously for a little bit you're like, I don't want to rest. But on the other side of it, it's like you move into a different gear and had the opportunity to show up at someone else's picket line a couple weeks later. If you've never been on a picket line, you should go. It's a very powerful experience. But the more people get in the habit of showing up in those ways where they can, the better. Another challenge that I think is true across the board is because of the nature of this sort of work in both fields, I think, and also because of the cuts we've seen over time. Um, People are busier and busier, and they're just trying to keep their head above water. And it's really hard to organize in those conditions. So that's something we can overcome, but it's a challenge. Um, and the last thing I'll say is that in order for us to be bargaining for very big things for ourselves and for our communities, we have to go beyond those bread and butter things, which do matter. I think there is sometimes a tendency to think that if we try for small things or narrow things, it'll be easier, that if we avoid divisive, issues within our membership, that things will be better. Um, I don't believe that's true. I think you actually need to find ways to knit all those things together. If you have more vulnerable members, you have to make sure that those issues are being brought to the fore and are part of what you're fighting for. The labor journalist Sarah Jaffe said in talking about the LA teachers strike in, I think, 2019, you have to give people something big enough to fight for. And so this notion of like, let's just go small so we can get as many as people as possible to be mildly in support of things, that's not how you win things. It's people being willing to fight. And that means going big. And, part of to go back to something we said before, part of what changed the narratives around teachers' unions wasn't just what they were bargaining for, but the fight. It was seeing CTU go out. It was seeing the LA teachers unions go out. And that's even true if you look back, the Teamsters went on strike in the 1990s. This is a union that does not have a reputation for these sorts of things. And in that moment, public opinion shifted in favor of that big Teamster strike at UPS and in favor of labor. Why? I think it was because people saw like, hey, someone's fighting. We don't feel like people are fighting for us, and now we see people fighting. That fight is really important and transforms those narratives too.
Yeah, thanks for all of that. I definitely agree. I think the sustainability piece is really important. How are we, balancing like staying active and keeping momentum without burning out because it is a marathon and this can't be carried by one person or a small group of people. We really all have to be in it. So how do we keep that motivation going and get people really plugged in? Josh, anything else to add related to kind of this concept of the collaboration or overlapping areas?
Yeah, again, I agree with what's been said, and I'll just add one thought, which is that unions can be um, kind of, narrowly focused on their own members, right? Or, part seeing themselves as part of a larger movement. And there's lots of examples historically of unions trying to narrowly protect their members, and that includes the history of unions being racist in various ways in the past. Um, and uh, and I think the more that a given union is focused on narrowly on its little things, the less able we are to collaborate, and the weaker the labor movement becomes. And so, that's a big um, thing to tackle. But the one thing I would say is I think it's really important for people who are members of unions and have this vision of a larger, a better world, a larger um, movement that we want to build to run and win the democratic processes in your union through which members can lead. I think the highest profile example of this in my mind is Sean Fain and his slate winning at the United Auto Workers, democratically taking over and then winning really big for their members. But anyways, just to say, I think that's the more unions who have movements like this within them to take over control and move them in the direction of doing things for society broadly, the stronger the movement will be, and the better we will meaningfully collaborate.
Thanks. And I feel like that sort of transitions us into this next question, which is, how can anchor institutions like universities and hospitals do a better job leveraging their economic and political power for health and education equity, right? Like these are two kind of groupings of institutions that actually do have quite a bit of power in their local context. So, what would we hoped to see from them? What could look different than maybe what we're currently seeing? Starting on the academic side, I'll start with you, David, and then we'll sort of swing back to ending with Jessica.
Um, it's a good question. I think one of the we've talked a bit already about the nonprofits, institutions not acting in that way, and I think a big piece of that is this notion that um, universities and nonprofit hospitals and all these sorts of institutions should be mimicking business. That it's not like we have this notion in our society, and it's particularly like a top-down message. That's where well-run things are. And I think that's one of those things that's super convincing until you think about your actual interactions with actual businesses, which is almost never my experience. Um, there are things that these institutions do that have to be run like a business and should be done well. That's great. But those institutions shouldn't think of patients as customers, shouldn't think of students as customers and things like that. And so one thing I just like getting out of that mentality of saying these institutions will deploy this ostensible bigger purpose to defend themselves. And so it's really important to sort of hold them to account to that sort of thing. They also in many communities, those institutions are big players. And I think are often not doing much with that power they hold other than advancing their sort of narrow interests. So, but there are opportunities. So one of the things that our union worked on this past time was we talked with the other side and did some interest bargaining, sort of like where our interests coming together. And we talked about an effort and we did come to an agreement on it, to push to get free metro passes where people could just use them without being charged each individual time for our employees. Right now, that exists in Washington, D.C. for students, but this was for employees. And so our thinking was, this is good for the city. We need, we want more people in public transit. It's good for climate change. It's good for the employees themselves. Will, reduce parking, all those sorts of things, potentially reduce transit time. So that's not the only reason we were having that conversation is because we on our side brought that to our management and sort of said, can we, as the union and also as the employer, kind of be going to the district and sort of pushing for that. Can we work with, can you bring on other institutions as we look at our other units and bring them on to try and find a way of solving a problem rather than accepting things as they are and sort of working within that. So it's sort of a small instance, but I think there's some potential there. And I'm hopeful that we'll be able to both sort of win that, but also replicate that on other issues in the future.
Yeah, thanks for that. That's a great example. And I feel like too, like maybe that can set a precedent for like not charging patients to park, right? Like, we provide free transportation to students because we want them to come to school. So shouldn't we be doing that for patients? Like we want them to be accessing healthcare. And I think that that is often a huge issue. I'd say like 20 to 30% of what I worked on as a social worker was transportation for getting to various appointments, right? So that's a huge issue for patients for sure. Um, okay, so now I'm gonna switch to Kaylin and see like what are your thoughts in terms of how universities or hospitals could better leverage their power?
Yeah, I mean, I agree with what David said. I think there's also uniquely for universities that they are intended to be and often claimed to be places where you have free expression and people are supposed to be in pursuit of truth and these kinds of concepts that they claim to uphold. And I think that when that is threatened is when you really have a test of whether that is true or not. And I think one of the places that unions can really bring that to the forefront is in how we hold the university accountable for protecting academic freedom, and ensuring that people are able to study the things that they had been studying and doing so with the level of rigor and protection that they need to do that kind of work. And I think the precedent is that universities and colleges have always been kind of forced to, whether it's to have a department in the first place that is going to study something like gender or African American studies or history, or what place they hold in thinking about the war and anti-war movement, really. Like they're not actually usually doing that out of some benevolence. Like they are typically forced to take a stance that we then call principled, but really was, out of necessity because there was power leveraged to ensure that they take that stance. And so I think right now the fact that there is such a urgent threat against academic freedom and the kinds of things that people can study, but also like the kinds of people who are hired and students who are brought into the university and the programs that the university says might be cut as a result of the ongoing threats. I think that is exactly where, whether it was just lip service or not, I think, you have the opportunity to call attention to the contradictions in what the university has said they exist to do and what they are currently doing. And that has so many broad implications for, I'm thinking about our public health departments, for example, where students are doing work on, threats to testing and identifying people who are at risk for developing certain kinds of cancers. All of that kind of work has immediate implications for people's health and whether or not they have the support to do that work and are protected both academically and also personally when they are in pursuit of that work, is really critical, not just for the academic enterprise, but also for all of the people that that work is intended to serve. So I think that is really a place where there is both an urgent need, but also a series of steps that the university could be taking. And I say the university, not specifically referring to the one that I am in, but also like colleges and universities as a whole, in terms of what position that they take right now in the face of things that I think they are taking as universal calls to end something like diversity and inclusion that really are not, that feel like they're taking an easy out that they don't actually need to be taking. And so I think, we have the ability to work in coalition, to make sure that they uphold what they can in this moment, which is a lot more than what the vast majority of them have been doing.
Yeah, I think that's such a good point. And I feel like students have been pretty clear about what their expectations are, and universities have seen drops in applications when they're seeing universities that are like responding really harshly in terms of like limiting academic freedom. So if we care about enrollment, then we should think about what students actually want. And oftentimes those are the things that are getting like that are either on the chopping block or have already been like dismantled. Michelle, any thoughts from your end?
Um, no, actually, I don't think so, but I can pass it to Josh.
Sure. I guess at the end of the day, I don't feel very hopeful, in this theme of nonprofits. Like, I don't feel very hopeful that hospitals or universities are going to be really accountable to communities until they are controlled by communities, which, in other, okay, so the idea of democratic control of the institutions that are meant to serve us makes sense. Doesn't sound super radical in my mind, but the implications of this, for a hospital would be like, not only do we have single payer, which means nationalizing health insurance in this country, but also and making that publicly run rather than having it be a profit driven thing. Anyways, I'll try to not go into that rant, but this also would mean nationalizing, or at least in some form making public hospitals, which is like a step beyond single payer Medicare for all system, but like what they're currently dismantling in Britain, having the hospitals be run by the government and therefore being democratically controlled. And I think I'm not as used to thinking about this in education, but it seems like the same principles would probably apply, that nonprofit sounds good, but at the end of the day, it's not directly accountable to the public, and therefore it doesn't directly serve the public. So okay, that's a big picture thing. And in the meantime, the what we can do to try to, and I think we should be organizing in that direction as unions, but in the meantime, also having a union, being really well organized, um, and being effective means we're at least having some democracy in the workplace, and at least, the more power teachers have, teachers care about the community, frankly, I think more than the administrators who are like, running the system or whatever. Same thing, probably even more so in hospitals. So by unionizing, we're at least partially moving in that direction by giving workers power and a say in terms of how things are run.
Yeah, thank you. Jessica, any final thoughts on this question?
Sure. It's funny as I was going to go down that ramp of single payer healthcare too. And just that, yeah, we need these institutions to be fighting for policies that actually are benefiting everybody and address a lot of these crises that our communities and families and union members are facing. But I think there's some very specific examples too. Well, one, definitely just voluntary recognition for new bargaining units. But in Massachusetts, for example, we're having an issue where there's a ballot question and there's something called the High Tech Council, and they're trying to have two ballot questions that would destroy revenue in Massachusetts. They're upset about the fair share millionaires tax that I had mentioned earlier, which has provided incredible resources for education and transportation. And so they are trying to get a ballot question passed that would decrease the income tax from 5 to 4%. Sounds like 1%, no big deal, but that's 20% of our revenue here in the state of Massachusetts. We're talking about $5 to $6 billion. And then an additional ballot question, that's a little in the weeds, but basically it would cap the amount of money that goes to like a rainy day fund and then trigger rebates. That would be a total loss of probably about $2 billion more. And so what would be great, and this is what we've been trying to get some of these public and private universities that are part of the High Tech Council to do, is say, no, we will not be a part of this group that is funding the destruction of revenue in our state, and call upon the High Tech Council to stop their really irresponsible and nefarious ballot question, particularly in this moment in time where we're facing such cuts from grants to federal funding to declining revenue already, et cetera. So that's a very specific example. But ultimately, I think we need our institutions to stand against authoritarianism right now. And I think they play an incredibly important role in this moment of time where we're facing democratic backsliding. And our institutions and our hospitals and higher ed institutions have a critical role to play in not complying with the blackmailing I mentioned earlier and the extortion, and standing up against the consolidation of the abuse of power by the federal government, and current occupiers of the White House, as my congresswoman says. But I really can't think of anything more important at this moment for those institutions to do, because all of that goes hand in hand with then protecting our democracy, our healthcare, our public goods, our public education systems, and that we have to hold up these pillars and make sure that they don't fall into the upholding of authoritarianism. And it's not a coincidence that or unexpected that our higher ed institutions in particular and public education are being targeted first. And so we have got to do everything we can. And unions, I think, play an particularly important role of forcing our institutions not to comply and not to give in to authoritarianism that we're facing right now. Quick statistic, from our researchers in higher ed is that, in the last 25 or 30 years they've studied, there's like a 50% chance that that we'd be able to get out of this democratic backsliding. And with the civil resistance movement, it's higher percentage, but it's still like 50-50. Without unions, it's like 27%, but with unions being a part of the resistance, it's 83%. And that is a really compelling statistic to me. And again, the importance of our unions and fighting for the common good, but also just fighting for a better democracy. It wasn't working before this, but certainly not going to be working better if we don't stand up to it and stop the backsliding now. But ultimately, that also goes hand in hand with one other piece, which is the growing wealth inequality. And again, this is why unions are so important. The conditions for authoritarianism go hand in hand with the wealthy 1% getting, I've heard, I can't quote them right now off the top of my head, but just the increasing wealth consolidation of the top 1% versus the declining wealth of the middle class and everybody below. And unions have got to be a part of that, and we've got to get our institutions to be a part of fighting that income inequality as well.
Yeah, that's a great thoughts and final thoughts in terms of thinking about what are the conditions for authoritarianism to succeed and what can unions and presumably institutions do to combat that. So we have less than 10 minutes left, and so I'm just turning to the Q&A. One question we already answered, but Jessica, this one is specific for you. It says, in what areas have you had to organize most post-Janus? And maybe just briefly describe what that means for folks who don't know that policy. And what pitch is the most effective amidst union busting?
Okay, so Janus was when our public sector unions faced essentially an existential crisis because it got rid of agency fee payers. So basically people who had to pay some dues to benefit from being a part of a union in first place. And so during that time, we had to actively re-engage all of our members. And for us, it was a massive effort to re-sign up people to make sure that they had filled out a union card that allowed for dues deductions. Otherwise, we would be losing the dues, and that was purposeful. They were trying to. It was an anti-union, union busting move. They were trying to defund unions essentially. But the good news is that our public sector unions, we got organized, and honestly, actually, I think it forced us to do the work that we should have been doing all along, which was engaging with all of our members and ensuring that our members understood the value and importance of collective solidarity and collective action through our unions. And so we actually grew our membership here at AFT, and I think a lot of unions did, but definitely here in Massachusetts we did during that time. And again, I think some of the themes that other people have been talking about are if if people see unions fighting for the common good, the things that are everybody cares about, especially right now, affordability, right? But access to good paying jobs, respect on the job, equity, fighting for things that everyone benefits from. In this situation, we're talking about lowering healthcare costs, affordability of housing, et cetera. Then people want to join us. And so we actually have had more people outreach to us in terms of new organizing than we have since I would say before Janice. But again, I think it's because you see unions that are fighting, then people want to be a part of that movement. And so, in terms of, I think the question was what has resonated in terms of signing people up.
Or
Well,
like
I will say,
how to respond to union busting specifically.
well, one, definitely inoculation. And so we did have to do a lot of education about who was funding Janus, why they're trying to, get Janus passed. And then we have to educate on things like the organizations like the Freedom Foundation, and the billionaires funding them and how they're really part of anti-union movements. And so a lot of inoculation you do with new organizing as well. But again, I think when people see what you're fighting for, they see the value in a union. Unions haven't been as popular, I think, in the last 50 decades since as they are now. And because of the threats of also just basically basic job protections, people losing their jobs due to the economy right now, people are seeing the value of the union. But I always say, I was a teacher. I'm a teacher activist, but I was the organizing director of the Boston Teachers Union before becoming president of the BTU and then AFT Mass. Is there are no shortcuts to organizing, right? And so what we needed to do during Janus and what we need to do today is the same. It's organizing, it's member engagement, it's listening to our members, finding out about what their issues are, what they care about, and then help making the connections back to how our union is fighting for those same issues too. And that includes also getting members involved in the electoral political actions. A lot of times people are like, oh, well, I didn't join a union for electoral political reasons. And we're like, yeah, I didn't become a teacher to get involved in politics either. But the reality is the politics impact our ability to fight for a good contract. And so if you care about XYZ issues, then that's why we also need to care about these ABC issues. But that goes back to organizing and listening and the basic rule of like just listening to our members first, and then helping to connect the dots back to the power in our union and our collective action and collective solidarity. So I hope that answers that question.
Yeah, thank
But
you. That was very helpful. Well, I don't see any other questions in the Q&A. Keisha, maybe I'll just pass it to you for any final thoughts or reflections before we wrap up.
This was a very invigorating conversation. So I want to thank everyone, all of our panelists, for being incredibly thoughtful, not just about your work, but also this moment in time. As you all were talking, a few things that just sort of popped up, this idea that you all are focused on bargaining for the common good, higher ed. Right, rhetorically, we are in this work of doing education, service, and research for the public good, right? That's been imbued in what our history is. And so I do think that there is a need for us to really rethink what our rhetoric is in context of our action, right? So we talk about community engagement, we talk about being anchor institutions, but we're not talking about it from a stance of collective action. And I do wonder what we can learn in higher ed from what you all are doing about how do we move or re-envision community engagement from a collective action stance, which is incredibly important today. And then coupled with that, what's resonating in my mind right now is what Kaylin said about accountability. A lot of higher ed institutions have CBAs, community benefit agreements, that are toothless. And so how do we begin to rethink the accountability that should be coupled with community engagement for collective action? So thank you for a really invigorating conversation. I don't think it's the end. I hope it's one of many more we can have. And just have a great holiday. But thank you very much for making time for us today.
Yes, yes. I will just echo thank you so much for everyone who joined us. I hope folks are able to take a little bit of time off to rest and recharge so we can continue the good fight because, as we know, this isn't going anywhere. So yes, thanks so much for joining us, and have a great day.